Madam President, I ask unanimous consent that Marcus Chavez be granted floor privileges for the remainder of today's session.
Without objection.
Thank you, Madam President. Madam President, as we approach the vote tomorrow morning, I know a lot of people are calling it a historic vote. And in some contexts, I guess it is. However, many of us are concerned that it's a historic mistake rather than a history-making opportunity. We've had a lot of debate about whether this legislation is the right or the wrong way to improve health care for all Americans. We've had hours and hours, in fact, days and weeks of committee hearings and meetings with good bipartisan discussion on options and ways to accomplish this. But now apparently we have a mandate by the majority that are demanding that we have a final vote in the Senate before Christmas. While we debate this, let me say, I believe we need to hear more from the people who are going to be most affected, the American people. Because the final details of this bill were not crafted in front of the American public. I think most people in America today know that the President pledged that this legislation would be crafted in a table that was around a table that is public, where in fact he said the C-SPAN cameras could be present. And so, in his words, so that people could see the deals people were making and who was working for the American people and who was cutting deals. Well, the C-SPAN camera was not present. The table was not open, the room was closed, and the bill was negotiated in secret. But we are starting to find out what the deals were. And the deals are outraging the American people as they see specific exemptions from certain burdens in the bill being given to certain states in order to get the votes from the senators for those states. We've heard about different proposals dealing with the state of Louisiana, the state of Florida, the state of Connecticut, the state of Nebraska, and the list is growing as we have an opportunity to deeply delve into the bill and determine just exactly what is in it. But we won't have time to know all of the details of these deals. We won't have time to even know all the details and how the bill works, because this 2,700-page bill, 400 pages of which were only disclosed last Saturday, will be voted on at 7 o'clock in the morning. Well, 3 days ago, I asked Idahoans who, like most Americans, in fact all Americans, want health care reform, to sign a petition on the internet asking the Senate to defeat H.R. 3590, because we need reform that will lower costs while increasing quality and keeping health care decisions between a patient and their doctor. The response to this request has been remarkable. In fact, I suspect that as I'm speaking, we've already gotten over 20,000 signatures on the petition on the internet. I asked people to go to my internet site, MikeCrapo.com, and simply sign the petition. And here is a partial stack. We're still printing out the rest of the names of the people who have signed the petition, but somewhere between 19 and 20,000 and growing people have signed the petition. And here's the remarkable thing about it. When I asked the people of Idaho to sign this petition, I asked them to do two things. I asked them first to go to the website and sign the petition. And then secondly, I asked them to contact everyone within their circle of influence, people on their Christmas card list, people on their email contacts list, people on their Facebook friends, and everyone who's within their circle of influence, and ask them to also sign the petition, and if they didn't live in Idaho, to contact their senator and encourage their senator to oppose this legislation if they agreed with me that it is not the path that our nation should follow. Remarkably, more than half of the people who have so far signed the petition did not get that information from me. They got the request or encouragement to sign the petition from a friend or a relative. And a huge proportion of them don't live in Idaho. In fact, we've had people from all over America in every one of the 50 states sign this petition. Why is this happening? And by the way, as I said, the number is growing. It's happening because the more Americans know about this bill, the more they know that it's not the path they want us to take for health care reform. Health care is personal, private, and a sensitive matter among individuals and their doctors and their family. This bill makes health care a public policy decision controlled by the government bureaucracy. Americans don't want that kind of government control over our health care economy. Yet instead, Americans see an administration and a congressional majority forcing this bill down their throats in a rush to pass it before public opposition legitimately overwhelms this wrong-headed monstrosity. Thousands are signing this petition because they desperately want Congress to listen, but they know that their collective voice has been ignored. The petition is one way that they can make themselves heard in hopes that this Congress will pass needed and sensible reform, but not this bill. In fact, another point about this petition is, in addition to getting on the website and signing the petition, individuals are calling my offices and saying, thank you for giving us an avenue to try to reach out to the Senate and tell the Senate to stop. I think thousands of Idahoans and people from all over America are eager to have an avenue to speak out, and we need to stop and listen. And I thank the thousands of Idahoans and Americans across this country for being willing to get involved as citizens and petition their government to respect our rights and to honor our values and to reform health care sensibly. The national polls indicate people oppose this bill. They want common sense, lower cost action that will reduce the cost of premiums and their doctor visits. This legislation instead raises taxes on the middle class, increases premium costs for many people now carrying insurance, cuts senior programs, and fails to lower health care costs. Simply put, there has not been a piece of legislation this decade that has come forward to meet more opposition than this health care reform bill. The more that Idahoans and Americans know about the bill, the more they dislike it. Health care is a personal, private, and sensitive matter, and this bill goes the opposite direction. But the majority is moving full steam ahead in hope that they can pass it before the public can understand what it is and register their opposition. If we'll take the time, we can improve the health care system. Without the tax increases, without the massive increase in the growth of government, without the pork barrel spending and the sweetheart deals, without the Medicare cuts and the unconstitutional burdens on state governments that this bill presents. Among the steps that many of us are trying to see enacted are things like allowing insurance companies to compete across state lines, allowing small businesses to band together to negotiate group rates for insurance, requiring pricing disclosures from healthcare providers to promote a competitive, consumer-driven healthcare market, and offering incentives for patients and their private sector to create wellness programs and other efficiencies in healthcare delivery. In fact, when a bill similar to this was presented as the Republican alternative in the House, with the provisions that the House Republicans proposed, it was scored, contrary to the bill we're going to be voting on, it was scored by CBO that it would actually reduce the cost of health care in America by significant percentages. And yet we are now continuing to plow full steam ahead with a vote at 7 o'clock in the morning on a bill that will increase the cost of health care. Madam President, the petition that I brought forward asks Congress to listen. It registers the fears of many Americans that they are being ignored by the administration and by the majority in Congress. And I'm going to continue to aggressively push for their wishes here on the floor of the United States Senate. And I'd like to take an opportunity now to go ahead and just get into a little bit more of the detail that we do know about this bill. Why do I say that it is the wrong direction for America? Well, to start out, let's ask what Americans want in health care reform. If you ask most Americans, and there have actually been a number of polls on this that have shown this, do they want health care reform? They say yes. When they're asked what they mean by that and what they want, the overwhelming answer is that they want to stop the skyrocketing increases in the cost of their health care insurance, that they want to control the skyrocketing increases in their medical care. They also say that they want to see increased access for those who don't now have access to quality insurance, both because they are compassionate and want to see that kind of health care for everyone, and because they know that they're paying for it in their insurance premiums, those who have insurance, and in their taxes, those who pay taxes. and they want to assure that we continue to have the highest quality of health care possible. That's what we are supposed to be doing. That's what this bill should be working on. That is the objective we should be achieving. And yet, what are we achieving? In an earlier discussion of the House bill, I believe it was the Wall Street Journal said it was the worst bill ever. We now have a different bill here in the Senate, but it still, in my opinion, falls into the same category. And why? Because it drives up the cost of health care, not down. It raises taxes, hundreds of billions of dollars. It cuts Medicare by hundreds of billions of dollars. It grows the government by $2.5 trillion, forces the needy uninsured not into a program where most of them can get insurance, but into a failing and less robust medical system, Medicaid. And that imposes damaging unfunded mandates on our state governments that are already sharing the burden of Medicaid and facing difficult, troubled economic times. It means increased taxes not just at the federal level, but at the state level with these unfunded mandates. It leaves millions of Americans uninsured, and it establishes massive government controls over our health care economy. Let me go through just a few of those and give more specifics. First, I don't think most Americans, when they talk about health care reform, think that that means we need to grow the size of our government by $2.5 trillion. That's right. Although there's some smoke and mirrors in the way that this bill is put together, because the first 4 years of its cost are not started until 4 years into the bill, and so when you try to count the first 10 years, you only see a smaller number. But when you take the first true 10 years of spending in this bill, it increases the cost of this government's health care expenditures by $2.5 trillion. As you can see here on this chart, look here at the first 4 years. The spending is basically deferred. Now, why would that happen? I'm going to explain that a little bit further in a minute when I talk about the deficit issues. But what it does is it hides the true cost of the bill. If you measure the true cost of the bill in the first full 10 years of spending, it's $2.5 trillion rather than the $1.2 trillion that it would be if you counted it otherwise. And so what we see is a massive growth of the federal government. That's not what people were asking for, and frankly, it makes them kind of do a double take when you explain to them that we are increasing the size of our government by such massive amounts with health care reform. And those proposing that we adopt this bill often say, you know, our objective and what the American people want is to drive the cost curve down. Well, I often ask, what cost curve are they talking about? If they're talking about the cost of health care or the cost of health care premiums, they're going up. If they're talking about the size of the federal government and the level of federal government spending, that's going up. There's one that they talk about. It's called the deficit. That is whether we are spending more than we are taxing and cutting. And they argue that the deficit is going down. There's only one way that you can argue that this bill does not increase the deficit. And that is if you assume that we don't have nearly $500 billion of Medicare cuts, that we don't have $500 billion worth of taxes in the first year and $1.28 trillion of taxes in the first full 10 years of implementation, and that we don't have several budget gimmicks. Now, what are the budget gimmicks? The first and biggest budget gimmick is the one that I just showed on the previous chart. They don't count the first 4 years of spending. They stop the spending and don't let it start happening for 4 years, so that we have 10 years of taxes, 10 years of Medicare cuts, and 6 years of spending. And when you balance that out, you can claim that it doesn't increase the deficit because you don't have a full 10 years of spending. There are other budget gimmicks. We have something called the SGR fix, or the increases or adjustments in the compensation rates for physicians that we all know on both sides of the aisle that we must do. We must keep the physician compensation comparable and moving up with inflation. That's going to cost $245 billion approximately over the next 10 years. That $245 billion cost to reform and adjust the Medicare compensation system is absent from the bill. Why? Because they're going to do it in a separate bill and probably not pay for it. In other words, not have offsets. But we'll see whether they have offsets. But it's not in this bill, and if it were, it would drive the deficit numbers by $245 billion in the bad direction. There are other types of gimmicks. For example, there is double counting of the Medicare cuts. The CBO came out with a report just today that said that if you cut Medicare by $465 billion, claiming that you're going to use that $465 billion to help make the financial situation for Medicare more stable, that you can't then take that same $465 billion and use it to establish a massive new government program. Yet a third major government health care entitlement system. You can't spend it on a new one and claim that you're saving one that's already facing fiscal collapse. It's these kinds of budget gimmicks that make many of us object to the bill. If you didn't have those budget gimmicks, if you didn't have those tax increases, if you didn't have those Medicare cuts, there is no way you could say this bill is deficit neutral. Let's go to the next chart. One of the things that CBO does report, I want to move to the question of the cost of insurance. CBO, which is the Congressional Budget Office, reports that the premiums in the individual market will go up, not down. Now, what does that mean? CBO breaks the insurance market into three categories: the individual market, the small group market, and the large group market. The individual market is the one that's primarily there for small businesses that don't have a large or a small group opportunity, or individuals who don't get their insurance through their employer. It represents about 17%, or almost 1 in 5 of all insured people in the country. Their insurance rates under this bill, 17% of all Americans, are going to go up. And the amount by which they're going to go up is about 10 to 13%, according to CBO. The next group is the small group market. They represent about another 13%. And again, CBO says, under this bill, their rates are going to go up. Not quite as badly, about between 1 and 3%, but up, not down. And that brings us to the large group market. The large group market actually fares a little better. This is the remaining 70% of the insurance of those insured in the United States. And basically the CBO report says that for them, there's a chance theirs may go down by 1% or 2%, but it's basically, it could be stable at a 0% change as well, because the individuals in the large group market, those who get their insurance from larger employers, have less liability of a harmful impact because they have that large group that can continue to negotiate to control their health care costs. So what do we see? Even under the best scenario, and by the way, there have been 9 or 10 studies of this, and the CBO report is the one that is the most favorable toward the bill. Most of the other reports have said that the rates are going to go up for everybody. But even if you take CBO's numbers, 30% of the people in this country are going to see their insurance rates go up, not down. And the other 70% can expect basically the status quo. In other words, not any change at all, if maybe a slight decrease. Now, is that what Americans were asking for in a robust health care reform system? No. Americans are asking for true, solid, significant control of the cost of their premiums and their health care costs. I'd like to move next to the question of taxes. As I've indicated previously, this bill increases taxes by, I think I used the number of about $500 billion. The president has pledged that he wouldn't sign a bill that involved tax increases on the middle class. And he defined the middle class, to be people who were, as individuals, making less than $200,000 a year, or as a family or as a couple, making less than $250,000 a year. And here's the president's pledge. I can make a firm pledge. No family making less than $250,000 will see their taxes increased. And he was pushed on this pledge, and he clarified it. He said, not your income taxes, not your payroll taxes, not your capital gains taxes, not any of your taxes. You will not see any of your taxes increase one single dime. That's the president's pledge. But what do we have? In the first 10 years, $493 billion in new taxes. Now the question is, do those taxes all fall on the so-called wealthy? Those making more than $250,000? Well, CBO and the Joint Tax Committee have analyzed it, and the answer is clearly no. But before I get to that, let's see what the taxes do in the first full 10 years of implementation. Remember, the first 4 years are kind of a slow start with the spending, but if you compare the taxes and the spending, count the total amount of taxes starting on the day when the spending really kicks into gear. It's not $493 billion or whatever the number was, it's $1.28 trillion in new taxes. Now, that is not what the American people are asking for. The next question you might ask yourself is, okay, how much of those taxes are going to be paid by people who the president pledged would not be hit? Well, the Joint Tax Committee has analyzed the bill, and by 2019, and the reason they use the year 2019 is that is the end of the first full 10 years of implementation. By the year 2019, at least 73 million American households earning below $200,000 will face a tax increase. And that's not just people making $200,000. That's everybody who pays taxes who makes any kind of income less than $200,000 in America. 73 million, not individuals, households, will pay taxes under this bill. Let's go to the, now one of the things that's interesting is in response to this argument, some of my colleagues on the other side have said, well, wait a minute, that's not true. This bill is actually a tax cut. Now, wait a minute, you've got me saying this bill increases taxes and someone on the other side saying, well, this bill cuts taxes. How could that be? Well, there is a subsidy in this bill for those who are at lower income categories and are provided government dollars or subsidies in order to purchase insurance, the ones who are fortunate enough not to have been pushed into the Medicaid system. That subsidy is about $400 or $500 billion in the bill. And it's administered by the IRS. And so it is claimed to be a tax cut. And if you offset that subsidy against the tax increases in other parts of the bill, then you can say, well, there's a tax cut in this bill. Well, first of all, that's not what the president said. The president did not say, I won't increase your taxes more than I will cut somebody else's taxes. That's not what he said. What he said was, your taxes won't go up if you are making under $250,000 as a couple or $200,000 as an individual. But even if you accept that argument, 75% or 73% or $288 billion of this tax subsidy goes to taxpayers who don't pay any taxes. Their income levels are so low that they don't hit the thresholds for incurring a tax liability. They get a pure, straightforward subsidy. The Congressional Budget Office acknowledges this and scores it as federal spending, not as tax relief. But either way you want to look at it, let's say you agree that that's a tax cut and agree to offset it, which I think is wrong. You still come up with 42 million American households earning less than $200,000 a year that will face a net tax increase. And the tax increases are not small for these families. Well, the bill grows the federal government. It pushes up every cost curve you could think of. It increases taxes. It increases the cost of health insurance. It increases the cost of health care. What does it do to Medicare? It cuts Medicare by $465 billion in the first year, and again, if you want to look at the first full 10 years, by $953 billion in Medicare cuts. And basically what we have here in this part of the bill is an absolute transfer from America's senior citizens right over to the new government entitlement program and a redistribution of that wealth to other people. Senior citizens who have, throughout their life, paid the Medicare tax, the Medicare payroll tax, and will now see the Medicare that they thought they were going to get cut. And what kind of cuts are we talking about that we may be dealing with here? The biggest one is the Medicare Advantage, $120 billion of cuts. About 1 in 4 American seniors has Medicare Advantage insurance. This is insurance that was provided in a contract relationship with the private sector. In other words, it was an experiment to see if we could let the private sector deliver Medicare and how they would do at it. And what they've found is that they can actually, through the Medicare Advantage program, increase the benefits that seniors get. This is probably the most popular part of the Medicare program. It's growing rapidly. The reason it's growing rapidly is because it provides better coverage. And those in the Medicare Advantage program are going to see their benefits cut. Another pledge the president made was, if you like what you have, you can keep it. Well, not if you have Medicare Advantage. It's also not true about a lot of people who have their insurance through their employers these days, because that's going to be lost to millions of Americans too. But in addition to the Medicare Advantage cuts, you're going to see hospital reimbursements, skilled nursing facilities, home health agencies, hospice, and others cut to the tune of $465 billion in the first 10 years. And the experts have all told us that what that's going to do is to make it not impossible for many healthcare providers in these categories to keep their doors open, or it will cause them to reduce the amount and quality of services they provide. So senior citizens are going to see their Medicare, particularly their Medicare Advantage benefits cut, and their access to care restricted and reduced under this bill. Well, Mr. President, in summary, there's been a lot of talk, again, about how Americans want health care reform, but we need to do it in a smart and sensible way. Many have argued that there are no alternatives being put forward by our side. As I indicated earlier in my remarks, that's simply not true. In fact, the alternative that was put forward in the House and the alternative that many of us have been talking about here have been scored to actually achieve the results that Americans are asking for. We don't need to rush this bill through in a claim that we are making history, but in a way that will be a huge historical mistake. The American people, in huge numbers, are asking us to slow down and stop it and start working together in ways that don't create a government takeover of health care, that don't drive up the size and reach of the federal government, that don't drive up taxes, but instead provide the right kind of approaches to medical savings, that don't slash Medicare benefits to our seniors, that don't put massive burdens on our states, and that don't force the neediest of our uninsured into a failing healthcare system, Medicaid. We're simply going to have to be back at this in the future if we don't get it right now. Only then we'll be facing much worse fiscal circumstances and very difficult problems with sustaining the fiscal stability of the two programs that we are now dealing with trying to sustain, Medicare and Medicaid. Mr. President, I urge my colleagues to listen to the people who signed this petition. People all across this nation in every one of the 50 states who are saying, wait, don't do this now, do some sensible reform, but don't make this mistake. I encourage all my colleagues, as we are literally on the eve of the vote that will determine whether this bill makes it through the Senate, to step back and take a deep breath and evaluate whether it would not be better for all of America for us to move a little slower and start trying to build a bipartisan solution that can have true benefits for the American people. And with that, Mr. President, I yield the balance of my time.